All right. We're going to go ahead and get started. We got a quorum now. Let me make an announcement to the committee and to the group. We got an hour to get this done. There's a committee right behind us. We're going to get these bills in. If you want to speak to a bill, keep it very short. Members, I would say if your vote depends on a question, ask it. If it's a story or if you need clarification, ask that too. But anything other than that, we're going to move through these today. First up is Chairman Hatchett with HB 663. Floor is yours.
Thank you, Mr. Chairman. I'm going to simplify this greatly, but HB 663 is LC 339688S, establishes a new category known as designated essential caregiver that can be present with a patient in a hospital or a nursing home in most all circumstances. And it requires hospitals to put visitation policies in place. I've been asked quite a few questions about this. A lot of people have looked at it. We've worked with the Georgia Hospital Association, and I've had several questions from others today and had a little tweak here and a little tweak there. I'm willing to work with others, hopefully, as this bill moves on. But one of the questions I was asked today is, what's your interest here? Why are you interested in this? So, trying to make this quick. Two reasons. One, some of you may know, some of you may not, but my mother passed away on December 5th of 2020 from COVID. When I took her to the hospital 17 days earlier, I knew it would be the last time I saw her. Fortunately, it was not the last time she saw me, because former Speaker David Ralston spoke to this in the well. He didn't use my name when he spoke on this bill 3 years ago. But I was standing on the helipad at our hospital, and she could see me from the ICU and talk to me while I was on the helipad. So she could see me, but I couldn't see her. So I did get to see her before she passed away. She was on a ventilator, and some people say, well, she heard you, but that's debatable. But more importantly, I have a childhood friend who also got COVID, and he survived after spending 110 days in the hospital and over 70 days on a ventilator. He is still alive. His wife is a practicing attorney in Dublin, and she legaled her way into staying with him in the hospital, and is a firm believer that had she not been there, he would not still be alive. She helped nurses. She did things. She followed the rules. She did whatever they told her to do, but she stayed. And she is a witness that had she not been there, he would not be with us. One of his doctor visits in the last 6 months, he went to see the doctor, and the guy stopped, and he was like counting on his hand. And my friend said, what are you doing? He said, well, you're one of 8 patients I had that were on a ventilator and also received dialysis. He said, 3 of them are still alive. He said, you're the only one that walked into my office. So that's the why I'm doing this. I think it will help our citizens in the unlikely future that we have another pandemic, and it will ensure that you can visit your loved one if you're a designated essential caregiver, and that if your child is in that facility, you can see them. With that being said, I'll entertain any questions.
Mr. Chairman, I move to pass.
Well, I tell you what, we got a few people that are for this bill. Out of those that are here for this bill, does anyone want to speak, or are we fine with what we've heard? Taylor? Okay, I'll call you. Yeah, right there.
Thank you very much, Mr. Chairman. Taylor Hawkins with Frontline Policy Council. There's a number of people here, by the way, to give personal testimony, so I understand for the sake of time we won't, but just want to recognize those, many of whom lost loved ones just like Chairman Hatchett.
Okay.
And want to thank the chairman for his hard work on this bill. We appreciate very much the sentiment of it, and appreciate his continued dialogue with us on the bill, and we would like to see it move forward and get over into the Senate so we can do something fantastic for the citizens of Georgia and ensure that so many who lost loved ones see that situation clarified and move forward in a way that they have access, patients have access to essential caregivers in the future. So thank you, Mr. Chairman, and we would urge the committee to pass this piece of legislation, keep the dialogue moving forward.
Thank you. Do you have a question? Thank you.
But it's so apropos.
Do you have a question? We're trying to get through this thing. Okay, good. Okay. Let me see. Lori Simonelli.
You got it.
Thank you.
Simonelli. Hi. You know what? I want to thank you very much. So I was here almost every day with my grandkids during House Bill 290. And so I brought pictures. I wanted to, if I can give you, Mr. Chair. This is the progression of my mother. So the red suit is today. So when she got in the lock, I'm sorry, sir. When the lockdowns began, Governor Kemp signed 10 executive orders in concession for the nursing homes. My mother has dementia. We had window visits. She's hard of hearing. She couldn't understand, and the women wore hazmat suits. I gave pictures of the progression of what happened in those 10 months. My mother didn't know my name anymore. My son's her favorite grandchild. They all got one. She didn't know who he was anymore. And it was horrific. And I was essential caregiver. My sisters had to fly in from Texas and Florida to have a compassionate visit. CMS demanded that. She went from 125 pounds and knowing all of us to 90 pounds and knowing none of us. That's what the lockdown did. So I appreciate everything you said, sir, and I urge you to pass this bill. Thank you.
Thank you very much. Do you have a question?
I didn't have a question. It was really more just a comment on Chairman Hatchett's point. I think he mentioned children, and we did have hospitals that took care of their caregivers. The nurses, our children's hospitals did. The entire time of COVID, they allowed those needy individuals. And I think what you're describing is a person who was just as needy in a nursing home, just as needy as a 6-year-old would be, if possibly more so, in a very critical time. And I appreciate the chairman for having a bill that recognizes that hospitals can figure out a way to do it. Nursing homes can figure out a way to. We were all working without a playbook this last time, but I think going forward, knowing that no one's family member will ever be left to suffer alone is a great comfort now. But it should be both to all of us and to our family members. So thank you, Mr. Chairman.
Representative Douglas.
Thank you, Mr. Chair. I just wanted to add to the bill a friendly amendment. No, I'm just kidding. My nanny cam bill would have been perfect for this bill because I had it in play before the pandemic, but they wouldn't pass it. So nanny cams for the people who don't live locally, who live far away, could have seen their loved ones. So I sympathize with everybody during this point. Thank you.
That was a good statement.
Thank you very much.
Very good. Okay, Julie Allen.
I want to thank this committee and the dignity of life that you're considering relative to this bill. I have a personal story. I have a personal story that I want to share. But first, I just want to say there are some things going on in the world that are very troubling. But first, I want to say this is a great bill. This No Patient Left Alone Act. Also, consider amendments relative to HB 1332 to prohibit healthcare facilities from instituting any policy that limits patients' abilities to be visited by a legal representative as a condition precedent to obtaining or maintaining a permit to operate a healthcare facility. And what I was to say about what's going on in the world, is anybody reading about the midazolam murders and what's going on in the UK? The excess deaths in the UK correlates with a widespread use of midazolam, the death protocol NG-163, that allowed lethal doses of midazolam and morphine for anyone suffering a respiratory illness, regardless of whether they were at the end of life. So there's a lot going on. Pay attention. There was a hearing yesterday Senator Ron Johnson hosted. If you can watch that, I recommend it. We in Georgia can do a great job here to take care of our people. But again, the stories that have been relayed, Representative Hatchett, I can identify with that based on my own experience with my mom. I was my mom's legal guardian from 1994 to 2015. I was the youngest of 4 children. In her last days, she told me that my father would have preferred that I wasn't born, but fortunately I was born in 1963 and not in 1973. What my mother have done if I were not born, because in 2007, while in a skilled care facility, my mom had lifelong mental health issues. This is where we're talking about the dignity of life. My mom had lifelong mental health issues, and in 2007, she was burned 47% full thickness burns. If you are a physician, you know what that means. They say that the odds of survival is you take the percentage of full thickness burns plus your age, subtract it from 100. She had no odds of survival. I lived in Atlanta at the time. Again, she was in a skilled care facility when this happened. I drove, went back and forth on weekends. She was Loyola University Medical Center. It's a top 5 burn center in the U.S. We have Augusta here. We have Grady here. That level of care, my mom's physician, personal physician, became, after being airlifted, the chief medical officer for the facility. She was there for 132 days in burn ICU, 3 weeks in acute wound care hospital, and then 6 weeks at RIC, which is the top rehab hospital in the world. Again, the chief medical officer. I'm here to tell you that she lived for 8 more years after that. Life is a journey. Life is hard for those with special needs and otherwise. But I'm glad that my mom passed away in 2015 because of the hell that families endured during the pandemic, not being able to see their loved ones. I was an advocate for my mother. I was able to move her down here, get her into a top facility, Emory, Wesley Woods, all of that. But I was always a tenacious advocate because she had mental health issues. I was visiting her daily to make sure that she was appropriately cared for and that we were a responsible family member. So this legislation is so vital because when you separate family members from their loved ones, often the patient doesn't have the ability to advocate for themselves. So again, I thank you for considering this legislation because of the dignity of life. And it's often we look at, this is the last thing I'm going to say, oftentimes we look at the life of the patient and try to make a determination of whether or not palliative care or hospice care, what's the quality of their life. I'm here to tell you that my mom changed lives, not because of she was a physician or a surgeon, but because of her tenacity and because of the journey of her story and our walking along with it. So sometimes people with Down syndrome, special needs, all of those things, they change lives, and it's not their quality of life that matters, but it's our commitment to the sanctity of life. So thank you so much.
Thank you for your comments. Anna Adams.
Thank you, Mr. Chairman, members of the committee. I'm Anna Adams with the Georgia Hospital Association, and we are proud to support this legislation today. Some of you may remember a couple of years ago, there was a piece of legislation introduced that we had some real challenges with, and that bill really kind of addressed consent more so than visitation. This bill is much more focused on visitation. We think it's a reasonable approach. It allows the essential caregiver into the facility, which is really helpful to our nursing staff. As you all know, we're dealing with workforce shortages within our facilities, and having family members who can help with those patients and keep an eye on those patients is truly helpful to our staff. So we appreciate Chairman Hatchett working with us on this, and we are proud to support it.
Thank you very much.
Thank you.
That's all that's signed up to speak to the bill. Do I hear a motion? Second. All those in favor say aye. Aye. Congratulations. Thank you. Okay, is anyone opposed? Hearing none, the bill passes. Thank you. All right, Representative Stevens with 1326.
Thank you, Mr. Chairman. Members of committee, I'll make this very, very quick. I know we got some folks behind me. This is the annual drug update bill. I'll ask for your favorable consideration.
Hear a do pass. Do I hear a second? Second. All those in favor say aye. Aye. All those opposed? Congratulations,
Thank you,
you
Mr.
have your
Chairman.
bill. I'm a quick learner.
That's it.
Okay. Next bill is Representative Clark. I lost 1046.
Thank you, Chairman. That's right.
We have heard this bill, so go ahead.
Hopefully for the last time. I bring before you House Bill 1046 LC 54036S. We have sat down with all sides. Should be good to go. Should be unanimous, hopefully. We took out the home health care part of it in the bill, so it only has to do with death certificates, allowing APRNs and PAs to be able to sign off if the physician signs off in their agreement. I think there's going to be 2 amendments from the committee to be added, and I'm in total
You're
support.
good with that, these
I'm
friendly
good.
amendments. Second? Okay. We do have 2 amendments that are in your book. Amendment number 1, after line 88, insert subsection 4, healthcare professionals identified in subparagraph A must complete a biennial continuing education regarding the recognition of the documentation of the cause of death and the appropriate execution of a death certificate approved by the Georgia Composite Medical Board. Do I hear a motion? Do I hear a second? All those in favor say aye. Aye. All those opposed? Amendment passes. Amendment number 2, after line 97 and 133, insert a selection box shall be added to the death certificate to be checked off by the non-physician completing the form. Do I hear a motion? Do I hear a second? All those in favor say aye. Aye. All those opposed? Now back to the main question. Do I hear a second? Second. All those in favor say aye. Aye. All those opposed? Congratulations, you have your bill, and thank you for working on this.
Thank you, Chairman.
You did
Thank
a
you,
great
committee.
job. Okay, moving right along. Let's, Representative Roman, House Bill 1314.
Move to pass, Mr. Chairman.
Give me 5
Can she sit down and speak before we pass it? You're out of order. Go ahead.
Thank you, Mr.
Representative
Chairman.
Roman.
Thank you, members of the committee. Today, I come to present to you House Bill 1314, specifically LC number 540371S, which is a substitute. This bill is intended to designate EMS as an essential service. It doesn't change who provides EMS, zoning, anything like that. And I worked with the Georgia EMS Association on this. They're good with it. But the reason for a bill like this is particularly for disaster-related grants and responses. It makes it easier for them to qualify for grants that other essential services normally qualify for. And, you know, our EMTs and paramedics do amazing work, and so it's about time.
I know you worked hard on this bill, and you have talked
Thank
to
you.
all the particulars and people associated with EMS. Are there any questions? Seeing no questions, do I hear a motion? Do I hear a second? All those in favor say aye. Aye. All those opposed? Congratulations, your bill passes.
Thank you very much.
All right, good job. Okay, 1302, Representative Bennett.
Thank you, Mr. Chairman and members of the committee. I present before you today substitute to HB 1302, working from LC 520524S. And this bill, what it does, and we've worked with MAG and OBGYN, this bill is makes a provision for maternal health screenings, prenatal as well as postpartum. It does also, or do I, anything else? According to our health parity, mental health parity bill, this type of screening is supported. It's supported in the literature by the Department of Public Health, as well as it is supported by the OBGYN and the Medical Association of Georgia.
I know that you worked hard on this bill. We've had many discussions. I know you've worked hard on this bill. We've had many discussions. I know that you've worked with different departments. Aldi, any questions? Go ahead. We got some good time. What are you, 7?
Thank you, Mr. Chairman. Yes, sir. I just
Chairman Hatchett.
question, is there a fiscal note on this on a projected expense?
There's projected expenditures, and we have Brandy from DCH here who may speak to it.
Okay.
Brandy?
That's my other job.
Good afternoon, Brandy Sylvan with Department of Community Health. The last version of the bill that I saw, we did anticipate a fiscal impact. These billing codes are currently open, but the last version I had seen mandated that these screenings take place at a certain number of intervals throughout the pregnancy, which would have just increased utilization. But my understanding is that the new language doesn't have the mandating language, so I don't anticipate there would be a significant fiscal impact to the plan.
Do you mind getting me the previous? Okay.
Yeah, and it definitely, once I have that final language, I'll confirm that with you as well.
Thank you, sir, Mr. Hatch.
Any more questions? Representative Douglas,
Make a motion.
state your motion.
Do pass.
Do I hear a second? All those in favor say aye.
Aye.
Well, congratulations.
Thank you.
Your bill passes.
Thank you, sir.
Oh, any opposed? All those opposed? All right.
Thank you.
Congratulations.
Thank you.
Your bill passes. I'm hard to train, aren't I? All right. House Bill 1340, Representative Hilton.
I brought some friends.
I found a friend just in case.
Thank you, Mr. Chairman, members of the committee. I bring you House Bill 1340. It's LC 520472. House Bill 1340 adds an additional 2 seats to the Georgia Behavior Analyst Licensing Board. Specifically, it adds seats for the organization called the Qualified Applied Behavioral Analysis Credentialing Board. We'll call them QABA for short there. QABA is the second largest credentialing board in the United States. This is adding seats to a board that was set up by Chairwoman Dempsey in legislation that was passed in 2022. The board is still in process of being set up and established, which is why we thought this would be a good time to add this organization. I'll tell you, as many of you know, I'm a parent of a child with a disability, and finding licensed therapists is hard to do. There's a dearth of people out there who do that, and so by adding this additional credentialer to the board, in my mind, that'll expand the number of options available to parents, including this organization in particular is approved by the Pentagon in all 50 states and TRICARE insurance, so making more options available for our military families. You'll hear folks speak for and against the bill, I believe. Some of the concerns I've heard brought to me are that their level of credentialing, they don't require as many hours. I've looked at both of them side by side, and they look very comparable to me. But at the end of the day, if your goal is to get more therapists out in the market helping folks with autism, this is the bill for you. So I will leave it at that. I know some folks want to testify in favor, and then we can hear from others.
Yes. Yes.
Yeah, go ahead and identify
Hi,
yourself.
everyone. My name is Gabrielle. Thank you. Hi, everyone. My name's Gabrielle Delis. Thank you for your time today, Mr. Chairman and committee members. Just very quickly, I represent QABA here in Georgia, and I just wanted to make you guys aware of a document that is in your packet that will answer any questions that individuals who are speaking for and against the bill. There is one that says QABA in Georgia, that it has the cost comparison. Yes, it has the cost comparison between the two organizations, and it also has the credentialing differences as well on the second page, which will be something that is brought up, that you can see that they're virtually the same. We just we specialize that it's the same. It's 270 hours for each organization, 5% supervised field work. You have to have 270 hours of coursework. It's relatively the same. We just want to ensure that there is diverse care in the state and options for parents to have, and we just want to make sure that we are providing the best care for individuals on who are looking to receive autism spectrum related treatment. And Holly right here can speak really quickly. I just want to make you aware of this
let me before Holly, before you go, I've got a question. Representative Parsons.
Yes.
Thank you, Chairman. Actually, I don't. But I had the light on. I can't get to go off.
I can help you with that. Thank you. Okay, go ahead, Holly. Identify yourself, please.
Thank you, Mr. Chairman and committee members. I'm Holly Benencosa, and I'm the Executive Director with the QABA Credentialing Board. I am not a behavior analyst. That is not my job. We have a credentialing board of directors who oversee the credentialing process. They are certified by either our board, the other board, or both. These are our clinicians that oversee the credentialing process. We also have a board of managers who oversees operations. These two boards do not touch. I am the liaison between them. We have a very rigorous accreditation that we go through called the American National Standards Institute. This is also called ANSI, and it's a very rigorous process where they look at everything. We are for profit, and that'll be probably some of the opposition you will hear today. We are for profit. Our accreditation looks at all of our finances and confirms that we are meeting the highest standard. ANSI is also the highest accrediting body in the U.S., and they do accredit a lot of different agencies here in Georgia. And so being for-profit allows us to put every cent back into the company, and this allows us to go ahead and provide people in developing countries discounted pricing so that they can also have high-quality access to care. I think that's...
Thank you, Holly.
Yes.
I tell you, we've got, if you want to stay where you are, we've got a couple other people that want to speak. Let's, I tell you what, let's hear from, it's a little hard for me, is it Cowan or Colin? No. Yeah, I'm sorry, would you want to come up to two? This mic right here, yeah, and go ahead and speak, thank you.
Thank you, Chairman. My name is Colin Muthing. I'm coming as a past president of the Georgia Association for Behavior Analysis. I also was the chair of the licensure bill, House Bill 412, that was passed in 2022, that went into effect July 1st of last year. The board has been formed. They are working on rules and regulations, so we are talking about amending a bill that hasn't gone into full operation. I am coming in opposition of the bill for some pretty specific reasons that I want to get into. There have been a number of states around the country that have had this bill presented to them, and all of them have concluded that the QABA credential is not equivalent to the BACB credential, which is the current credential within the law. I want to go through some of the differences, right? Because I know you have a document in front of you as well. Yes, QABA has 270 hours of coursework. The BACB requires 315. But I do want to really point out the supervision aspect of this, right? So there was talk of 1,500 hours for the QABA certification, with only 5% of oversight of those. The BACB requires 10%. Additionally, there is no stipulation for QABA that those 15 hours have to be directly working with an individual. I want to say that again. You get 1,500 of supervised hours, but you actually don't have to work with a child with autism. that to me is a real big issue with quality with a vulnerable population. They're not even required to work with that population. I also do want to point out that it is impossible for a consumer to go into the Quaba website and find out if a certificate has received any sanctions. There's no way to know if anyone holding that certificate has been sanctioned in any way for breaking any of the ethical code or any of those rules. It's a real big impact on consumer safety for Georgians. For a vulnerable population, we are talking about individuals with autism. I'll open it up for questions if you have any.
Yeah, go ahead. Representative Parsons.
Okay, I've got a question now. And I could have asked anybody this. I'm just not clear, or really understand, what decisions does that board make? What do you have to vote on, or what do you decide with that board?
Which board? I'm sorry.
The board that exists by the legislation was passed.
The Behavior Analysis Certification Board is a national certification board that certifies the entire country over, tens of thousands of behavior analysts across the entire country. Is that what you're asking?
Oh, I'm
not
asking
answering
about
your
the
question.
one that was created by the
So,
legislation.
Mr. Chairman, the board that was created here for Georgia is responsible for licensing therapists, behavioral therapists here in the state.
Okay, that's my
yeah.
question. Thank you.
Yeah. I'd submit to you, when you're the only show in town on the board, you'd want to keep that. So I think it's healthy for us to add multiple and have different perspectives on that board.
Okay, thank you. Any other questions? Okay.
Can I add one more
Thank
thing?
you very much.
Thank you.
Let me see. Let's do Kinslin Vaughn.
Thank you, Chairman. My name is Kristen Vaughn, and I am a board-certified behavior analyst. I have been board-certified for the last 10 years. I am speaking against the bill due to the differences in the qualifications of requirements in order to get this certification. As my colleague spoke, the certification to become a board-certified behavior analyst requires more education, more oversight, and we are dealing with a very vulnerable population. We're dealing with, in this nature, people with autism, and people with autism can have a varying degree of disability, and a lot of our learners can not report what's going on, and we want to make sure that having more regulation and requiring more certification, more requirements is going to elevate the space. And I know that we are talking about adding more. By adding more, we're going to have more access to care, but more access to not great care might not be the best option for the population that we're trying to serve. The Behavior Analyst Certification Board, when I came into the state in 2020, there were 650 behavior analysts, board-certified behavior analysts. Now today, there are over 1,500. So the Behavior Analyst Certification Board is working quickly to meet the access to care issue that is being stated as a reason why we are wanting to expand, why Quaba wants to add the certification. I do think changing the licensure bill right now is absolutely problematic when we haven't even rolled out the licensure yet for behavior analysts. Thank you.
Representative Newton.
Thank you, Mr. Chairman. I was just looking over, we do have a sheet here, and it just caught my eye because Fort Eisenhower, where I used to serve, is on there, and I know I assume it's the EFMG, the Exceptional Family Member Program in the military, and so this seems to indicate that we may be short in some areas that may have a larger preponderance, since both Fort Moore or Fort Eisenhower would be specific bases where individuals really from anywhere in the country might be assigned if they have a dependent who needs this care. Are you saying there's plenty of care out there now, or
I'm not
it's
saying there's
or-
plenty of care. I'm saying we are working towards doing that. That's what the Behavior Analyst Certification Board is. Within 4 years, we have added a significant number of behavior analysts to the space, and I think we can anticipate the rate of behavior analysts in the space is like a hockey stick. That's what we're seeing. So there are more board-certified behavior analysts being credentialed every single day.
If you don't mind, Mr. Chairman,
Go ahead.
just on the other, the sheet that compared the graduate degree, the code of ethics, background check, things like that, the coursework, and then 5% supervised field work looks identical in both sides. And now I do agree, just job shadowing or working isn't the same as supervised clinical training, and we've discussed that a lot when we discuss the tens of thousands of hours involved in supervised clinical training for medical providers. How this 5%? By the way, is that the same in both sides for about? I mean, it's two organizations. I know in medicine we have osteopathic physicians and medical MDs and DOs, and we treat those identical.
Yes.
How are because the training requirements and the certifications are close to identical. How are these different?
They are close to identical, and I agree with you there. One thing that I will say is, as my colleague was mentioning, that 10 states, right, have really looked at this and reported that it's not the same, that the QABA certification is a lesser certification to a BACB certification.
I'm sorry, who's
BACB?
I know, who says that?
The state of Texas, the state of Kansas.
You're saying as in they don't allow this to?
No, they have squashed it, saying they've done all of the research and they have squashed it. And our national board has also stating that this is not an equivalent certification.
It sounds like the military has come to a different decision in many states, at least if this Virginia, Iowa, Nevada, Vermont, Indiana, and Arizona is accurate. I'm sorry, I guess there's some states that have gone one way and some have gone a different.
And a big part, the big part of what the licensure bill is stating is adding qualified behavior analysts into the licensing board equates them to board certified behavior analysts. Board certified behavior analysts are approved, or our scope of practice isn't just autism treatment. And one thing that my colleague also mentioned is a concern with the care of the individuals. And so how can we make sure that a qualified behavior analyst does not go out and try to use their license to treat patients who are not on the autism spectrum because they are now licensed behavior analysts?
Representative Knight.
I guess a follow. There are two questions, and I'll go back to the author and them on one. But just to follow up what you're saying, I'm trying to understand that. So you're saying that, or at least the way I heard it, is that QABA is basically focusing on autism?
Yes.
But not other maybe disorders or behavioral issues outside of...
I can't speak to that directly. But it is more autism focused because they are taking autism focused classes. And in the behavior analysis program, we are treating behavior, we're not treating a specific disorder.
So I guess I want to differentiate because the purpose of licensure, okay, and boards is quite frankly protection of the public, okay. All licensures are there. We're trying to put professionals on there to make sure that the public is protected. And so I guess I'm trying to understand that if there's a broader, and I'm sorry I don't understand the broader perspective of behavioral, issues, autism being one, but I'm sure there's a very broad spectrum of behavioral issues that if you're going to license somebody, wouldn't the qualifications need to be there to make sure that they're qualified across the spectrum? And I don't want us to make sure we're I guess.
Yes, I agree. I agree with you.
And that's a fair question because I think my friend Representative Hilton would agree we're protecting the public. So that's one. The second thing is I want to go back to a for-profit versus nonprofit. A lot of times in a for-profit, we've got alternative motives for doing things. And when we talk about it international and giving discounts away, I mean, I don't know. That one is usually, when you're for-profit, that's one of your main missions. I don't know how you speak to that, and maybe it's a question. Are the other ones that are on here nonprofit?
Yes.
So could there be a purpose or a different, I guess, drive, if you will, being a nonprofit versus a for-profit? And those are, I guess that's a concern or differential that I wanted to ask or
So-
have.
Great question. And based on the data that I've seen, the for-profit, what I like about for-profit is they're to compete, and in doing so, you look at the fees that they charge, it's comparable, if not even less, than what the non-for-profit is charging. I'll defer to someone who is with the organization to tell you kind of their profit motives and how they beat the competition.
Sure. So, you know, you have in your packet, you have the side-by-side of the cost comparisons in there, so you can see it's very similar. Every cent that we have made goes back into the company to update our software, to update the enrollment process, to make things easier for those who are applying for the certification, because their job is hard enough. We don't want to make it more difficult. So we invest every cent back into the company to better the process, to provide people, like I said, those in developing countries, you know, discounted exams. So.
We hear all the time from our constituents the licensing process is cumbersome and painful. That these folks do it easier is a good thing.
Representative Douglas.
Yes, thank you, Mr. Chair. I want us to think seriously about this situation. It's kind of like what Chairman Noonan was talking about yesterday with the prescription things that we were dealing with in our state. And sometimes you have to go back to correct things before they start. And so this contract is not even in place. The rules and regs are not in place. And so we dealt with this yesterday with the drug program of trying to, in the middle of, I would say, in the middle of a agreement to go in and try to change everything when you already have contracts that's put forth in the middle. It's hard to do that. And so what I'm trying to get across to you guys is basically, let's go back and talk about the rules and regs. They're not in place. So how can somebody come in when the rules and regs are not in place already and add to that when it's not already in place? I'm not saying I'm against it, but
Yeah,
if the rules and regs are in place first and then you add, that's amenable. But when we don't know what the final say is about the rules, then it's kind of commingled.
I would
everything.
submit. Yeah, I would submit. I appreciate your opinion. I would submit now is the ideal time because if the ship were up and running and going, I don't want to disrupt it. But since the ship is kind of being built as we're speaking here, I think this is the right time to let's build it the right way before we put it out to sea. And Mr. Chairman, you and I had spoke before. I've got Judy at ease right now waiting for me. Yeah, so you've got an expert here who could testify, and I'm going to hop downstairs if that's okay with you.
That is fine.
Thank you. Thank you,
Go
Mr.
ahead
Chairman.
and go. We've got, thank you, ma'am. We've got three others to speak. How about Malia Davis?
Thank you, Chairman and committee. Let's go. Okay. When Jake was a little boy, he did not speak. He didn't play with other children, and he was very disconnected from the world around him. He was aggressive and not only hurt himself, but he would hurt others as well. Jake's mom, concerned for Jake, sought help. After long appointments and many tests, Jake was diagnosed with autism spectrum disorder. ABA therapy, the doctor said. That will help him. So Jake's mom once again sought help. But this time, Jake's mom couldn't get the help. There was no access to care for Jake due to his insurance. Jake's mom knew she was the only option to help her son and knew that her son couldn't be the only child suffering from not having access to this type of care. And this is when her life became dedicated to the field of ABA. Jake's mom spent many long hours working in the field of ABA, studying the field of ABA, and actively helping her son Jake's development every day. Today, 15 years later, Jake is almost 18 years old. Jake speaks like me and you. Jake has friends. He loves to skateboard. He's looking for a job, and he no longer hurts himself or others. Today, 15 years later, Jake's mother is a behavior analyst, licensed under the Quaba Board that owns an ABA company in coastal Georgia, providing ABA therapy to 23 children and families who didn't have access to the care before she took them in. Jake's mom serves military families, has donated 3 years of services to a child in which this child did not have access to this care. This child ultimately graduated ABA and is living a wonderful life. Jake's mom has written letters to her military family's chain of command showing the importance of why the children stay in her care and how the lack of access to care would be detrimental to the child during PCSing, in which these letters have been approved by the military. By not allowing the Quaba Board to have state licensure in the state of Georgia to practice ABA would be extremely detrimental. Children and their family would lose access to care. Clinicians who have dedicated so many years of their lives to this field and to their education would lose their careers. Their livelihood would be destroyed. My name is Malia. I'm a behavior analyst under the Quaba Board. I'm a business owner, but most importantly, I'm a mother. I am the mother of a beautiful boy named Jake who is diagnosed with autism spectrum disorder. Thank you for listening to my story. Oh, I'm sorry.
Thank you. Thank you very much. Any questions? Not seeing any. How about Natalie Tusa? Oh. Do you want to ask a question?
Oh, okay.
Oh, okay. I'm sorry.
Thank you, Mr. Chairman, and thank you for your sharing.
Thank you.
God bless you. I am curious though. So, these boards are being developed now. They are not in place yet. I guess that's what Representative Hilton was saying. And you've been doing this for a time. You and many others, hundreds of others, or dozens of others. I'm not sure. Is that correct? You've been doing this care,
right?
But now there's a new board being formed, and you want your type of training and certification to be included in the board. Is what this bill does. Is my understanding.
Correct.
Okay, I understand. So this is going on now. It's not prohibited in Georgia. It's
No.
just if there's going to be a board, you guys would like some representation.
Right. So
Okay.
what it would do is, we're allowed to do it now. What it would do is, if we weren't put into the licensure, it would take our careers away. What we're doing.
I understand. Thank you.
Thank you.
Representative Knight.
Thank you. I appreciate your story. I know my wife and I are part of a Stepping Stones in Griffin, which is a very very dear part of our community and serves a lot of folks with what you're talking about with the specific disease that you're talking about. But I guess my question is going back to, and you are licensed under this.
I am.
Okay. So again, this is very important for the state because
Correct.
and help someone who's not educated on this from a point of view of that part of the profession. I used to practice as a CPA, life ago, but as a CPA, you could practice in a lot of different areas,
Mhm.
okay? A lot of different things that you could do. But in here, I'm trying to understand if the Quaba is just really focused on one behavior, but there's a lot of behaviors across the board. In other words, is that the case? And I think from a philosophical point of view, if the board's going to be there, you got to have a lot across the board from a point of view if you're going to hold yourself out.
Right.
Just like a doctor holds himself out, or somebody else holds himself out. Are you trained and up under this? Are you trained to address other types of behavior?
So I think what you're asking is, so we work on behaviors as a whole.
Mm-hmm.
So we work primarily to increase if there's skill deficits in a child, we work to increase those skill deficits. And then we work to decrease problem behaviors and replace them with functional, behaviors. Is that kind of what you're
I don't know because I'm not part of the other thing, but I'm trying to ask a very valid, serious policy question, because I know in a lot of different professions there's a whole lot of different issues that you address, okay, and it sounds like autism, from what we're hearing, is a very big focus of this organization that the QABA, okay. But I'm curious as to what else is out there that maybe this accreditation from QABA doesn't touch on a lot of the other maybe behavioral health issues that are out there. And so if you're licensed, I can go do everything, but I'm really wondering if that does address and qualify those folks that are accredited under QABA to really be out there to address a whole line of behavioral issues across the board.
So applied behavior analysis, that's the science that we use. And what it does, what I would like to say is that ABA, applied behavior analysis, is used probably 90 to 95% towards individuals with autism. And so that is why QABA believes that they must know who they're working with. It is behavior analysis, so we do other aspects of behavioral health. It's not just autism, but we have that component mandatory because that is the most population that uses ABA is towards autism. And so that's why we believe it's important to have that component in there. But if someone was to become a QBA and go into a different part of AB, like animal behavior, they can use those skills that they learned in their coursework towards animal behavior or other aspects. It's just the highest percentage of ABA is used towards individuals with autism and other developmental disabilities. So that's why we have that component in there.
Representative Macy.
Thank you, Mr. Chairman. When you're saying, is it ABA or QBA? Help me with that first.
So ABA is going to be applied behavior analysis.
Got it.
Okay, that's the science. Then there's also QABA, and that is the credentialing board. That is the Qualified Applied Behavior Analysis Credentialing Board.
Okay, so is the QBA autism only? Are we looking at a tiered licensure here?
I don't think so.
Okay.
Well, it's not tiered, is
So
it?
basically what we're looking at is we are looking at the overall Georgia Licensing Board for behavior analysis.
Gotcha.
And we are looking for both credentialing boards for applied behavior analysis to have seats
Right.
on that board
I understand.
for licensing.
Thank you, Mr. Chairman.
Thank you. Okay, let's go ahead and hear from Natalie Latas. I'm sorry, I probably killed your name.
That's all right. It happens all the time.
Go ahead.
Thank you, Mr. Chairman and members of the committee. My name is Natalie Latos, and I am a qualified autism service practitioner supervisor, and extremely proud to be one. We proudly serve the military families, as Malia has described. Without this state licensure, these families would have significantly more difficult times finding the services that they need. Without us, the QASPs, there wouldn't be enough support within each clinic to provide the appropriate and adequate care for the children and their families. We know that behavior analysts do so much on a daily basis, and having QASPs to be there to support them when it comes to providing hands-on parent trainings, conducting intake assessments, monitoring and modifying behavior intervention plans, reviewing progress reports, and providing supervision and trainings for registered behavior technicians. Behavior analysts would not be able to do that alone. QASPs help with that, and they are essential to making that function swiftly. I am so passionate about my job. I have been wanting to do this since I was 15 years old. It has been my career trajectory, and I plan to make it stay that way for the rest of my life. It is a gift to have my QASP certification because this serves as my stepping stone towards the rest of my career when I do plan to become a behavior analyst and get my master's. Getting your master's is a very time-consuming process that pays a lot of money, and I'm currently not in the position to do that. But that's why my QASP certification is such a gift, because it prepares me for that next part of my life. So I get to practice my supervision skills, my leadership skills, and learn so much more through this. I'm increasingly getting my knowledge every day from my fellow QASPs and from our behavior analysts. And without that, I would not be as knowledgeable as I am today without this certification. Not only would losing these credentials be a complete and total disservice to my clients and their families, it would also be detrimental to my livelihood and my coworkers. I've based my whole career. I have my bachelor's degree in psychology for this. I'm getting my master's, as I've mentioned. Well, I'm planning to eventually. And it would demolish everything that I've put towards my career if I were to lose these credentials, and it would set me back very far. So I spent countless hours studying and preparing for this certification, using my past degree, learning more, doing my own research, going through the QABA board. Fortunately, the QABA board allows virtual proctoring as well, which is extremely accessible for people who are applying. You don't need to go to a specific center or building to get your certification. You are proctored by, there's someone watching you on a screen, and you're proctored from your home or from wherever you can. And that was extremely helpful, especially for, times during COVID, I'm sure. So my goal, as I mentioned, is to become a behavior analyst, but I know that I wouldn't be able to be as knowledgeable and prepared without this stepping stone of having my QASP certification. And I'm very honored and happy to be here today, so thank you for hearing me.
Thank you. Representative Cannon.
Thank you, Mr. Chairman. I represent rural Southwest Georgia, and spoke to my hospital, and they are telling me that they're having trouble getting autistic therapists because they can't get licensed. Just a time delay there. So would this help solve that problem by just having a state board versus a national board would streamline that licensing process? Is that kind of what this bill would do?
Yes, it should. I just want to give a little bit of background information because I feel like we're getting kind of tripped up about the initial board. So the initial board, this was a bill from 2022. It was 412 by Representative Katie Dempsey, and the bill wrote in only the current organization that is written into the bill, and we just want to add QABA, just 2 seats. It does not impact the organization that is written in as now. You are allowed to hold both certifications with both organizations. It does not impact. You can be a QABA and then also hold the other credential as well. You can have both. It's even better if you have both. That you don't have to pick and choose. You can if you want to. The current board has 4 members that have been appointed by the governor. The 5th is a consumer that has not yet been appointed, that we just want to have 2 qualified behavioral analysts on this board as well so that they can issue licenses so that there is not a gap in care. That if, for instance, if you've heard from the women that have testified today that this would impact their careers and their livelihood, that their credentials right now could not be renewed in the state, that is a disparaging care, and we already have a lack of healthcare resources that we don't want to put further despair on a community that needs these resources. That we just want to ensure that we have individuals that have access to these resources. That you have any more questions about the board, I can give you more, but.
Representative Douglas.
I have 2 quick questions. I enjoyed your testimony. It sounds like you have a great passion for this. I don't know if you know the answer, or maybe the ladies with you can answer this. How many of you guys right now are licensed in the QABA? How many licenses in the state of Georgia do you guys have so far?
It's in the packet. about 200 individuals. It's in the packet. I think it's underneath the, I have a copy of it.
200. And one other quick question. What other states are you in right now under the QABA? What other states are you in?
36. Yeah.
I didn't see that in the package.
So North Carolina, we have a license bill that we're in North Carolina that was just recently passed. We also have QBAs certified, and I believe it's Vermont, Virginia, Iowa, Nevada, and Arizona. And we are working with other states as well to make sure that there's plenty of access to care. That is our main goal, is access to care.
What?
Representative Newton, Chairman Newton.
Thank you, Mr. Chairman. So I guess under are there people licensed in this field QABA now in Georgia? Is that, and you're saying you think that when this board is established that they would cease to recognize a license you already have?
Yes.
That's okay.
Yes.
And you think that by having
Yes,
two
that's why we would
two
just want
members
to have
being
two
on that
members
board,
that can continue to
that
issue
would-
our specific licenses in the state, because right now, as the bill is currently written, is that the only organization that is written in is the only one who can issue licenses in the state through the Georgia Behavioral Analyst Licensing Board.
So do
They
you
are
need
the
a
only ones
license
that
now
can
to
issue in the
practice in the
state.
state?
Yes, they are, but
Who are they issued by? By the board? The board doesn't.
No, they're private.
It's not. So at this time, there is no
Georgia
licensing
licensing
right
entity.
now.
Okay.
But this board that we are talking about would be the board structured to offer those licenses. You would have to apply to get licensed through them.
Are you sure they
So-
wouldn't recognize QABA?
So QABA is, they're
Trained.
basically certified people. So these professionals are certified. They're credentialed through the board, just like the other board. They are certified through that board.
Right.
But this is going to create licensure, so people have to be licensed in the state of Georgia. But as this licensing board is right now, it only names one board, and it doesn't include QABA.
Okay. Thank you.
Yes. So,
Representative Knight.
One last point, because I'm trying to compare it to other professional licenses board that I am aware of. But you have, the board promulgates rules and regs about qualifications, standards, and things like that. So if I just heard your comment correctly, you're saying that unless you get two people on this board, that y'all, or if you get two people on this board, you'll be able to issue license up under your group. I am confused about the bigger picture because I thought that these boards come together, they agree on standards, on accreditations, and that there's one qualification across the board of what Georgia thinks is qualified as a doctor, a lawyer, a CPA, or whatever, but there's not multiple different qualifications for the same profession. Is that not how it works?
So there's two certification boards. There's two certification boards right now. There's the QABA, and then there's the one that's listed in your packet, the BACB. These both boards, they certify professionals to provide behavior analysis. So what this board does, the licensing board for the state of Georgia, once licensing goes into effect and this board is created, we are asking that there's representatives from both certifying entities. So that way it provides the access to care for both QABA professionals and BACB professionals. So there's two certifying entities, but there's going to be one licensing board, and we want representation from both boards. And they're the ones that are going to write the rules and the requirements for licensure for the state of Georgia.
Representative Douglas.
Yes, I had a question earlier about the licensing, how many people are licensed in the state of Georgia. I just looked through your pamphlet, and it says about 9. So where did the 200 come from, 9 or 7? Oh, altogether.
Altogether.
Okay.
9, 114, and then 7.
Yeah, so we have.
7, 9, and 114.
So we have a 3-tier model parallel to the other board, and the QBA, which is the highest, the behavior analyst, is parallel to the BCBA, the behavior analyst for the other board.
Okay.
The QBA was accredited in 2020, so it is a newer certification. And when it was released, it was very parallel to the other board. And so we are, because of state licensure and everything, we are getting more QBAs coming out and taking the exam and passing it as an option, you know, because people like choices. And so that way it offers them another choice.
Okay. Mr. Chairman.
Yes.
Do we have any time left?
No, we're out of time. There's another committee that's got this room right now. I know Sheila wants to speak. Sheila, can you, do you need to, or can you do it fast? You good? I was on a different bill and I'm just. Great, okay. Representative Knight.
That's me.
Oh, okay.
I move to pass, Mr. Chairman.
Do I hear a second? Second? All those in favor say aye. Aye. All those opposed? Congratulations, the bill's passed. Thank you.
Thank you, guys.
Thank you to the committee.
Sitting through all that.
Yes, thank you. I know it's been a long day. So sorry to make it longer.